Today, more than 100 new COVID-19 cases were reported coming from child care centers across Texas.
Since March, the state says there have been more than 2,000 cases in those facilities, more than 1,400 among staff, and just under 700 include children. KXAN investigator Arzo Dost reports Austin Public Health is doing more to study how it's spreading at child care centers.
We have not put him in any child care setting this summer. Normally we would.
Stephanie Rubin is mom to an 8-year-old.
We are not sure what we're going to do about public school.
She also heads Texans Care for Children, an advocacy organization which focuses on health and early childhood, and says parents like her need more information from health officials about what's happening at child care centers.
What we're missing really from the state is real straight talk about what the risks are, what they're finding in terms of transmission. Are there hot spots?
State health officials are tracking overall numbers, but the data isn't publicly available. Other states, including North Carolina and Oregon, update their websites with the numbers of COVID-19 cases in child care centers and even include the names of centers with clusters. We've been trying to get that information since May, but the Health and Human Services Commission says that information is confidential, and our request was sent over to the Attorney General. A spokesperson with the agency says they are working to provide publicly releasable data, but when that could happen is still not clear.
Numbers out of context don't really give us the information that we need to make better decisions about how to care for our children.
Kathy McCourse is with the United Way for Greater Austin, which focuses on early childhood education. She's also part of Austin Public Health's COVID-19 Child Care Task Force.
But we really need more information on what do the programs that are seeing cases have in place. What are their screening requirements? What are the ratios?
Austin Public Health says it's in the process of setting up a small incident command structure for child care centers, a place they can turn to for questions and what they can do when they have a confirmed case. Arzo Dost, KXAN investigates.